For me, the best indication for this type of navigation system, this is microinvasive surgery in spine. For example, all percutaneous spine stabilization or all percutaneous type of vertebroplasty or intervertebral augmentation, for example, in the spine jacks or the different implants. This is very, very useful, and it minimalizes absolutely the incision, and visualization of spine is perfect for me. The most important thing for me is to use 3D reconstruction of the spine. It is not present in operating theaters navigation systems. So this is the biggest advantages of your navigation. And the second one is I can correlate the 3D visualization of spine with the typical sagittal transverse and coronal plane, which is available on the left side of the mirror when I'm looking for the patient. Yeah? So I think this is the most important thing. During operation, when I was looking into the mirror to the spine, to the virtual spine, it was very comfortable for me. This is natural position of the spine surgeon, because every of us look for the patient with the flexed neck forward. So it was nothing different, natural process of open surgery. Incision should be only with the Jamshidi needle. Sometimes if we want, we can increase the incision with the knife, of course, but everything is very, very good visualized, so we can very safe perform operational process. And I think that your navigation reduce the human errors. Right now, if you want to lock all the instruments which are responsible for the working of the navigation system, we must make incision, because we must insert the stiff and passive frame to the human skeleton. In that situation, we don't need this. So this is the first reason that the aggression of the surgeons are less. Next one, I think that the 3D visualization of spine cues that we don't need any increasing the surgery, and we can do everything with the microscopic supports to the spine. After the first case, I feel that Jamshidi works very, very good with your navigation system. I think that the system is fast, it's natural, it's useful, and everyone can work with your system, I think, with any special tutorials. It was my first time, and I felt during the surgery very, very comfortable. It was very convenient to me. So the learning curve, in my opinion, is very, very not hard, not stiff, and everybody can use this. This is very, very spontaneous system of navigation. The automatic segmentation and colorization of the system is very useful, because I can decide what want I to see during the surgery. For example, all spine or anatomy bony anatomy with the neural roots and neural elements, for example, dura mater and spinal cord. But if I decide to insert the screws only to the pedicles, I can see only the pedicles, or pedicles with the transverse process, or pedicles with the spinosus process. Everything what I want. It's up to me what I can see during the surgery in the mirror of your navigation. This is a very, very good solution for me.